Saddle up with AMSN this fall by registering for the 2025 AMSN Convention happening September 11 through 13 in Austin, Texas.
You're in for 3 days of medical surgical excitement.
At the convention, you'll join hundreds of like-minded nurses at enriching educational sessions led by over 80 industry speakers, 11 different networking and meetup opportunities, and so much more.
Elevate your medical surgical practice by joining us in Austin for #AMSN 2025.
Register now at amsn.org/events/AMSN Convention.
On this episode of Med-Surg Moments,
Men versus women, gender roles and bias in nursing.
I just started my 4th master's class on the 18th.
One thing I kind of didn't realize about the last update I had is, it's new for me since I went back to work. It's like
we were driving along and we got lost. It was the cutest thing I've ever seen in my life.
I have applied for the AMSN grant for this upcoming convention.
I saw the performance and I can't help but cry.
I think the male nurses get more respect than the female nurses.
We just roll with the punches, which is why we probably take too much verbal violence, I should say.
Have you ever had, as a male nurse, patients not want you taking care of them?
I see some older nurses that say, oh, you shouldn't do that because you're a male. Goes, oh, I don't think a male should be doing this to a female.
That's another bias I hadn't even considered when
our nursing supervisor actually asked, is it okay if I promote him first? Excuse me?
Definitely had some creepy experiences with male patients that I feel like
you can't control what other people say about you. You just control your
Cold fall.
Where's Eric?
Cold silver. Someone has a gun.
Where's Eric? And I'm like, yeah.
This is Mary Tess.
Sam.
Eric.
Marcella.
Kellye.
and Sydney. Welcome to Med-Surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud Med-Surg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey. Our topic today is men versus women, gender roles and bias in nursing. But before we get started, let's begin with some personal updates. Sydney, why don't you get us started?
Thanks, Marcella. I'm really looking forward to this topic today. As far as personal updates, I just started my 4th master's class on the 18th. It's a nurse informatics class. My last class was a physiology class, so more anatomy, things that you learn about in your undergrad. So this will definitely be a higher echelon of nursing that I haven't really explored yet. So I'm looking forward to learning more about informatics, especially in the world of AI and everything that's coming out in healthcare. I'm sure we're going to talk a lot about that. It's the second week of class, so I really haven't done too much yet. Professionally, just really looking forward to the convention coming up in a few weeks. That's about it for me. What about you, Eric? What's new with you?
I'm kind of really excited. I'm trying to see if I can make it work and see if I can get to the 2025 AMSN convention in Texas. I don't know. I'm still trying to work out a couple of the bugs, but hopefully if things go right, I can do it. One thing I kind of didn't realize about the last update I had is, it's new for me since I went back to work. It's like a whole new staff. There's like 1 or 2 nurses that are there, but everyone else is kind of like new. So I've been just learning and building with these new relationships with the unit, and it's coming along pretty nice. How about you, Mary Tess?
I don't have a boss right now. That's either a good thing or a bad thing. It's good because you get to really be creative, but also sometimes it's not good because you need some guidance. So that's where I'm really at right now with work. Personal update. My family, we went to a park here in West Palm. It was so accidental. We were driving along and we got lost. And then I'm like, what's the nearest place that I can park? I saw that place in Google Maps. I saw it was free to enter and I'm like, we'll do it. It was the cutest thing I've ever seen in my life. Baby turtles. Sea turtles? loggerheads. Reflecting back, looking at how small things can be bigger things. That's exactly what I felt. They're taking care of the baby turtles, and then once they're ready to get out there, they put it out in the ocean. We need to take care of us when we are little, when we're still starting out, and then when we're ready out there, it's pretty something huge. How about you, Kellye?
Oh, wow. Thanks, Mary Tess. In that situation with you finding a boss and having a manager, it can be both good and bad. I'm just coming out of that small whirlwind of us finding a new manager. So for me, the workload has been pretty intense as the educator on the unit, kind of taking on some of those responsibilities, but definitely happy for the structure. For me personally, I'm just coasting along. I have applied for the AMSN grant for this upcoming convention. So I really, really hope to see you all in Austin. I'll keep you all posted on that because I'm very excited and wanting to attend. Never been to Austin, never been to a convention. So that would be pretty neat. And also kicking off this week, I'm very excited because it's my birthday week.
Happy birthday!
August has always been my favorite month. I celebrate all month long, but this week I'm just gonna take my PTO and just really enjoy and just really do some of the things that I want to do. Maybe go out to eat with some friends, just kind of keep it low key, do some things with family. So that's that. What about you, Marcella?
I have a lot of respect for birthday time. Enjoy it, Kellye. You deserve it. I know. I can tell you work hard. You guys didn't have a boss for a while. You were probably the boss that whole time. I already know. Let's see. Summer ending. So sad. I remember in the middle of summer, I had a midsummer life crisis. And that's when I referred back to our bucket list, which helped guide me. But it's bittersweet. I love the changing seasons. It's so nostalgic when school starts. Oh man, I just get sucked back into being 10 years old, all the fresh notebooks, and I'm going to be the best student this year. I remember thinking that. And then one quarter in, I'm like, I hate school, but I'm trying to keep the momentum for my kids going so they don't feel that. But end of summer, yeah, my daughter, my teenager, she was in theater camp this summer where they get paid through the city, and she loves theater. She's been doing play productions for grammar school every chance she gets. So this production is such a great experience for me to witness to because it's a lot of hard work they put in. It's like an intense 5-week situation where it's like Monday through Friday, 9 to around 1 until it's the week of the shows. And then it's like 9 to 5, Monday through Friday. It's incredible. So this year, what they performed was Hadestown. She was a little sad not to get a lead role, but it's her first year in the program. And you can do this all the way through 20 years old. We told her, you're going to have to put your work in and keep going every year. And then you'll probably be more considered for the main lead roles. But yeah, Hadestown. They learned 30-something songs because the whole thing is sung. There's no just talking parts. And another class builds the sets. So you can either take the course as an actor or you can take the course as a set builder, and they do the lights. So these are all teenagers putting the entire thing together. I saw the performance and I can't help but cry. These teenagers put all their sweat and tears into it. She's hopeful. I'm hopeful that in the next couple of years, we'll get to see her as the lead. It's so legit. Sometimes the mayor goes, the governor goes. It was at least 7 performances that these kids did of this piece, and it was really worth all the work they put into it. All right. Why don't we move on to our topic? Men versus women, gender roles and bias in nursing. From being called sweetie rather than nurse, to male nurses being mistaken for doctors. We're diving into the everyday gender bias nurses face, how it shows up, how it affects us, and what it might take to finally break the mold. Who would like to get us started?
I mean, I'm okay with the bias. No, I'm just kidding. I see it firsthand as being one of the few males on our unit. And I've seen it ever since I started. I think the male nurses get more respect than the female nurses. That's what I say. No. I see it from both sides. Like I see the way the patients treat me as opposed to a female nurse, but maybe I'm nicer too. But I think they treat the men with a little more respect than they treat the women. And how many times they get mistaken for a doctor? It's innumerable.
I think I've even made that mistake.
Honey, sweetie, babe. I hear that all the time. For the female nurses, not me.
I take a motherly role when I'm a nurse, not in the context of gender, just in the context of mothering.
Yeah, I don't take it personal, but I know some would. And I have seen some that do take it personal.
We just roll with the punches, which is why we probably take too much violence, verbal violence, I should say. But I think we can still acknowledge that the biases exist.
I don't know. I feel like it's such a sensitive subject because you're basing it off of people's feelings. I see some older nurses that say, oh, you shouldn't do that because you're a male. Foley care or putting in a catheter. I remember I needed assistance just to have someone help me do it on an older female patient. I couldn't find anyone. So I was like, oh, let me ask my charge as a last resort. And I said, hey, can you give me a hand? And she's like, well, what do you need? She said, I'm really busy. I said, oh, okay, well, I just need to put in a catheter. It's okay then. Then I go back to the room and there she is gloving up. I said, oh, you can help me? She goes, oh, yeah, here, give it to me. She goes, no, here, I'll do it. I said, well, what do you mean? She goes, oh, I don't think a male should be doing this to a female.
Oh,
so yeah.
Spicy.
I know.
That one's a little triggering for me.
Well, that's what I said. When I first started, and I had a wonderful instructor when I was a student. And the nurse said, oh, he can't do this because he's a boy. She said, no, he's a nurse who happens to be a male. You could do it. He could do it. And that always stuck with me. Admits come, first serve, right? So I remember one time I got an admit, 18-year-old Appy college student was just going to be there. And they're like, okay, Eric, just take that patient. Then 10 minutes later, a person with C. diff, hemophiliac, homeless, lice, measles, mumps, rubella, combative. And they're like, oh, Eric, here, you take this one and I'll give this one to Amy. I'm like, well, what? Why? She goes, oh, because he's big and dirty and burly and she shouldn't have to deal with that. I said, no, she can deal with that because she's a nurse. You shouldn't just do it just because I'm a male. They always think just because you're a guy that you could do things that the other people can't do.
Have you ever had, as a male nurse, patients not want you taking care of them? They want a female nurse?
The only time that it actually did come up was cultural. It was a cultural thing.
It's not triggering because I kind of understand that. If it's the patient asking for a cultural reason, religious reason, but when staff is doing it, I'm like, you know better.
Yeah, especially not charge nurse. I would hope that they had your best intention at heart. I have heard of cases where, especially if a patient's delirious and, you're all down there and then they're confused and things start to tumble. But again, like you said, you're a nurse and you're able to do your job just like anyone else.
I actually did have one time a patient who didn't want a male nurse, but there was like nothing they could do because it was like kind of late. And I said, well, just give me a chance. And then long story short, she turned around and then I got to keep her for the next 4 days.
Yes.
But except for cultural, I've never had that. And I'm okay. Like you said, it's cultural, sure, I don't mind. Nothing personal. It doesn't bother me at all.
One comment I've heard once from a patient, it was the middle of the night. I was night shift and I took over for a male nurse. I walked in and it's the start of the shift. I'm doing all my checks. Is your oxygen on? Is your pad clean? Those first 4 hours are always chaos. So I just want to just come in, check everything, say hello. And it was an elderly woman, very sick. She was on our unit on and off for months. She said, I think only women should be nurses. I took a second to just take a breath. So, because I don't want to take anything personally. And I didn't even know where she was coming from. But spicy again. I'm like, what do you mean? How dare you say that? No. I said, oh, why do you say that? She said, no, it's just the attention to certain details. And I just feel like he was so fast paced. I just wanted to hear her complaints because they weren't even necessarily complaints. They were just what she notices. I've seen some Instagram nurses that make this joke. It's like the chill male nurse. Patient's good, see you later. And then sometimes patient's good, see you later. And then you have to call a rapid on the patient they said was just good. So chill can be a good thing and chill can be sometimes just not noticing certain things. So I think that's another bias I hadn't even considered when she brought that up. Being more emotionally invested in the patient. I can't pinpoint exactly what it is. But at that point, I was like, well, the specific concerns you have, I can definitely make sure that all the nurses are taking part in those. But it was just an interesting conversation to hear that perspective from a patient.
It sounds horrible. It sounds almost sexist, borderline me saying it. I think when people think of nursing, they think of care. Who gives care? Mothers give care. So they think, oh, this is like a female job. And if a male nurse isn't in touch with the softer side of themselves, I think that could be a valid point, that they overlook those finer details.
I wanted to share a different perspective. Not sure if you know, my husband is also a nurse. I asked my husband if I could share this, by the way. And when we were starting out as nurses, we graduated the same time. We're both second courses. We went to the same hospital as our first nursing experience. And I'll tell you, our nursing supervisor actually asked, is it okay if I promote him first? Excuse me? Is it because I'm female and he's male? I didn't ask that, but I said, well, he's my husband. I support him. So I said, go ahead. But that really triggered a question. And I asked myself, is it because he's male and I'm female? So I went back and asked her, is it because of competency? Is it because of what? Am I not deserving to get promoted? And she said, well, he's the provider of the family. You're one family. And I'm like, see, I knew it.
Ooh.
I knew it. That's a bias. And so from then on, we promised ourselves that we should never be working in the same hospital. We still did, but we worked in different departments, making sure that I'm not in his area or territory or either or. Nobody would know that we are related, even though we work together, because I feel like there is a bias out there. So he went to the Med-Surg unit because we all started both in Med-Surg. And then he said, I don't think I am for Med-Surg. I am for ED. Well, he's an ED nurse until now. But I agree because of the calm, let me get it done kind of a thing. He doesn't have any drama. He just want to get it done. For me, I'll be like, oh, let me talk, take care of a patient, all this kind of stuff. But I don't know if you can relate to that, Eric. You're like, no drama. Just get it done. That's it.
I am pure drama.
Yes.
Eric breaks the gender norms, the gender biases. And I love how you said that, Eric and Mary Tess, how we can acknowledge that each gender might sometimes have certain strengths. And Eric, you said the job pulls you to work on something that may come easier to women in some scenarios. Right. Not all, but it just may come easier and it pulls you to work on that harder. Or you can take the route of Mary Tess's husband and say, you know what, I'm going to work in this area where my strengths are even more appreciated. So you don't necessarily have to change. You find something that works for you. And I think that's great that he recognized that. My husband, he worked in healthcare, same hospital, and he was a transporter, taking the patients to their testing. And he would comment on the fact that male nurses, IV cords, lines, and drains, he said they were always so tidy. And he said, the young female nurses, I'm just noticing, I don't know what it means. I just know that theirs is always a tangled mess. Kind of brings us back to details. My patient might think that I pay more attention to the emotional details, but a male nurse might bring a more task-oriented detail to light that I need to build my strengths on.
When I first started, before I went to Med-Surg, I was going to do L&D. Then I got there and I thought, I don't want to see babies for the next 40 years. I felt that I should go to the ER or ED. But while we're bashing men, let's not forget that there are some women that do not have that maternal instinct, and maybe they should go to the ER as well. Because there's some women that keep tidy cords.
No, exactly. That's why these biases are a problem when you apply them to everyone, because not all women, not all men. And that's so true.
Yeah, that is very true. Eric, you mentioned a lot of the male nurses migrate to the ED. In my workplace, it's male dominated. but the few that trickles in my Med-Surg department, I have to sometimes encourage some of the newer ones because a lot of them may be discouraged from that senior nurse that kind of downs them about them being a male in a nurse's role. And I always tell them, being a caregiver, it's not gender specific. If you have the compassion, if you have the competency, if you have that critical thinking, that's what makes you a good nurse. And it's just not gender specific. So if you are a male nurse and you want to go into nursing, I always challenge them to just use what you know as a nurse, use your experience, use your critical thinking, because you all males, y'all have a different approach to resolving conflict. A lot of times on Med-Surg floors, I get the male nurses to handle certain conflicts that goes on with my female patients because they listen to men better. They listen to male in a different perspective or a different view.
Use their biases against them.
There you go.
It's true.
You're right.
True.
So that is true. So, and y'all tend to not worry what everyone else thinks either. Very slim few females that have that approach, but men carry a different approach when it comes to patient care and advocating for patients and just the way y'all think. Y'all are wired different, but that's the beauty of it. You know, we need you all.
How about the nurses here now, the female nurses? Have you guys ever experienced any of that bias in a negative way? Or have you felt it from like staff or patients, or where do you guys feel it from? Where do you feel the push from?
Definitely had some creepy experiences with male patients that I feel like them saying or doing things that they definitely would not to another male. Those are the patients that you unfortunately do assign to the male nurses because they're making all the females uncomfortable, or vice versa, patients asking exclusively for males and there's no males on the floor that night. As much as we love having male nurses, it still is predominantly a female career. There was this one time, which it was kind of a ridiculous request, but we had this patient, double above the knee amputation. She really wanted to go to the bathroom on the toilet, but we didn't have all of the accommodations set up to transfer her there. She was freshly from surgery. She was on bed rest. And we just kept explaining to her, like, ma'am, we have to put you on the bedpan. Like, it is unsafe to get you out of bed. And she was like, pick me up. Someone carry me to the toilet. That's not exactly how it works. And she's like, go find a man and have him carry me. And I'm like, first of all, there's no men working right now. I probably could carry you, but we're not doing that right now. So it's some things where they have these high expectations that they think because we're telling them no, that maybe a male nurse would. Some of those are some of the two spectrums of the biases that you get as a female nurse, at least from my experience.
I'm guilty of that too. I've carried a couple of patients to the bedside commode or picked them up off the floor because it was so much easier than waiting for something.
Well, yeah, it's like a transfer.
Yeah.
Essentially 100% transfer. It was like she wanted someone to just like give her a piggyback ride.
And then we get your patient the next day and they're like, well, the last nurse did it.
I was getting ready to say that. Well, I had the male nurse the last time.
Nurse Eric.
You get him again. That's right.
Code fall.
Where's Eric?
Code silver. Someone has a gun.
Where's Eric? And I'm like, yeah.
I remember, because I work in med-psych, there was one patient and they said, oh, you can't assign that to Mary Tess because she's small, she's female. She can't deal with that patient. And I'm like, really? But that's just a bias. But I said, well, sure, why not? Not a problem. And then, of course, what I had to do is increase my knowledge and my training. I did my CPI training. I did advanced training. And then I eventually told them I have dealt with behavioral health patients before, but it's a bias. It's like I felt bad about it, but then you know what? I had to let go because I always believe you can't control what other people say about you. You just control yourself. So I'm like, you know what? Let it go.
I'm sure we're all guilty of it as people that have been charged, is trying to evaluate what's on the floor and what's going to be the least chaotic of a situation. It is a bias, but
we're just too flexible. We're too good at our jobs. We try not to let any of these things just stop us in our tracks. We kind of like wiggle around them. But as a team, we can accomplish anything. And I think even these biases, like we've said, we use them to our advantage. We might have a male nurse just approach the room and lay down the law, and then the patient assumes it's a doctor, and then everything is smoothed over. Well, believe it or not, we're just about out of time. Let's go around and have each of you share your biggest takeaway from this conversation.
My takeaway is biases are perception of other people about you. What you think and feel about yourself is what's important and not what other people think. And so when you experience biases like these, you just have to stay true to yourself and learn to stand up for yourself, speak up for yourself. You know your skills, you know your knowledge, you know that you can accomplish things regardless of what people tell you. You are enough. I always tell that to myself, especially when I'm having some down moments or if I feel or somebody told me something that I don't want to hear. I always tell myself, you are enough. Biases are always out there, but at the end of the day, it's really up to you how you perceive yourself and how you take care of yourself.
A takeaway for me, I was going to say the bias will always exist no matter where you work, what unit you're in, male, female, senior nurse, new nurse. There's always going to be biases. So I would say embrace the bias, know your strengths and weaknesses, and act on your strengths. And utilize your coworkers and your teammates for the weaknesses.
Knowing yourself and being confident in your skills and then relying on your team. That's all you have at the end of the day to get through your shift.
And I think the only way the bias is ever going to change is if we continue to keep standing up for ourselves.
Just prove yourself and what you're worth and have your own individual interaction, not based on anybody's presumptions. To our listeners, thanks for joining us. We'll see you next time.
We look forward to connecting with you on the next episode of Med-Surg Moments, the AMSN podcast.
In the meantime, we encourage you to subscribe to Med-Surg Moments wherever you listen to podcasts.
To reach us, use hashtag MedSurgMoments on your social posts.
Or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We are all AMSN members, and if you love Med-Surg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the Med-Surg Moments podcast represent the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Eric,
Mary Tess,
Sam,
Kellye,
Marcella.
And Sydney. And always remember, Med-Surg Moments is a moment in our lives and a moment in our Med-Surg careers that makes a huge difference.